For those of you who need repetition, this is another view of disconnecting a medication that was administered into a PICC intermittent infusion device. So the medication is finished, the flush is finished, the machine is beeping complete. So you come into the room, you inspect the bag, make sure it's infused completely, check your lines, make sure everything is as it should be. And we know that the flush has gone in and cleared the tubing. It took 25 milliliters to clear that long tubing. And I go over to the power off button and push it very hard till you hear a little kind of pink, and then it will power down. So your machine is off. So you don't waste too much time assembling your equipment and getting ready to do the saline flush and then the HEP flush. But first, when we disconnect the fluid tubing, we must protect it and keep it sterile. He's showing us the equipment that he's using, and he's going to show us the heparin. That's going to be the last thing that infuses. We always start out by clamping because we're going to be disconnecting this, and we don't want red cells backing up into the cannula or the catheter. So we clamp before we do anything else in terms of disconnecting. We're going to open our pre-filled sterile saline syringe, 10 milliliter syringe. We're going to push just a little bit to get the air bubble out. It's got a little diaphragm in there, so it's difficult to get that little air bubble out until you break the seal of the diaphragm. We're going to open the little white cap that protects our IV fluid tubing so that we can use it for up to 72 hours as long as we keep it sterile and airtight with these little white caps. And we do use a new one each time. There's a little blue attachment that for some reason is attached to the white cap, but we don't use that part of it. We're clamped. We're disconnecting. And we're going to protect that tubing. If you touch it to anything, we end up having to rehang all new fluid and all new tubing. So you need to keep that carefully clean. And he is being careful, and he's covering it. Screw that on there nice and tightly, and you could literally drop it on the floor at this point if you needed to. It is protected. We've got our alcohol, and we're going to scrub the adapter that's on the little tiny, like 3-inch extension tubing. We prefer to deal with that because if you are manipulating the catheter close to where it goes into the child's skin, it could interfere with its solution, or excuse me, its setting appropriateness into the vein, or it could introduce some organisms. So we screw our saline into the adapter, we unclamp, and you'll see the student using a push, 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 pause motion after unclamping to provide some turbulence that keeps the red cells from flushing back into the IV catheter. The student's checking for a blood return. We usually do that once a semester. If you get a little flash of blood return, you want to continue pumping until you've infused a total of 5 milliliters saline, which is standard for the PICCs and the centrals. And he's screwing it back in because he forgot to close the slide clamp. The slide clamp's now closed, and he's keeping that Doesn't have to wipe it again because it's hanging there in the air. And now it's going to open the very dilute heparin, 10 units per milliliter. Keeps the red cells from coagulating around the end of the catheter, so that's why we end with the heparin. Unclamp. Push, 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 push. Preferably sliding the clamp closed as you're exerting positive pressure. Showing us that he's closed the clamp before the syringe was removed.